So I feel like a natural, great third question would be cardiac screening, right? So you don't want to wait till the last minute and have to experience any of these things. So say, what is the best what is the best frequency of getting cardiac screening? What should people be asking for? How often should people come and see a cardiologist and go for ECGs, exercise ECGs, etc.? What is your advice on that, doctor?
Yeah, actually, it's again a very important question. Now, say once you are more than 20-25 years, right, it's worthwhile checking blood sugar and a lipid profile, and if at all, ECG just as a baseline. If not, it's abnormal, it's your baseline. It's always better to know what your baseline is, right? And once you get, if it is normal in that stage, you can check your cholesterol in 3 years. I would prefer blood sugar again 2-3 years, because these things are not developing overnight. If you are in 20s and 30s, you don't want to check this every 3 months. Some people, I'm seeing, people are checking blood sugar every 3 months, cholesterol every 3 months, right? You don't want to do that, right? It's just waste of money. So check it for your baseline. If it is normal, 2 to 3 years time, right? But if it is marginal or high, then you have to go to your doctor. And say for your cholesterol levels are high, and then you need to take treatment, and the treatment is guided by a lot of parameters depending on his risk. Actually, we are lowering their cholesterol, but for that they have to go to the doctor and get the advice from them. Then they will decide how frequently that they need to do cholesterol. And even the patient who comes to me, sometimes every visit that they are coming, they are bringing cholesterol. I'm asking, why do you do that? Because it's a real waste of time. But they are so anxious to know it. No, it shouldn't. We don't want to waste your money like that. And once you start the treatment, again, you don't want to worry very much about that, except for blood sugar. Blood sugar, of course, we have to check very frequently, and sometimes home monitoring at home, maybe twice a week, would be better rather than once a month. So that is an exceptional thing. In case of blood sugar, you need very tight control. But for cholesterol, other things, we can check quite. We don't want very frequent checkup. Only exception is fasting blood sugar, and better to start early. I said it's 20s and 30s. That would be, if not it's abnormal, it would be your baseline. Then you know that at that time ECG. So most of the patients, sometimes I'm telling this now, when they get chest pain, they goes to the doctor, and doctor take ECG, and ECG also shows some changes. Right now, doctor is worrying whether these ECG changes are related to the chest pain, but most of the people does have some ECG changes naturally, because just like your height and my height is different, and your color and my color is different, ECG is not also the same for 100% each and every individual. There may be subtle normal variation. So that's why I said ECG better to take say in your 20s and 30s. That will be gives you idea. So then when you carry that to the doctor, then doctor knows that this change was there even when he was small time, was childhood, and is nothing much to worry on that.